Hey guys, Tony Maritato here. So this is an elliptical trainer, and I really think an elliptical trainer can be one of the most effective pieces of equipment to start using after a total knee replacement. In this video, I'm going to show you how to get on, how to get off, how to safely use an elliptical trainer, and I'll give you a couple scenarios in which I think the elliptical trainer is actually much better than a bike or a treadmill. So let me show you. Most ellipticals are going to be built very similar. The pedals are going to be large flat pedals. If you're working on or learning how, trying to decide how to get on and off the elliptical trainer safely, in this case, I'm going to pretend that it was my right knee that had a total knee replacement. So typically what I'm going to do is I'm going to bring the pedals around so my non-surgical leg can step all the way over onto the lower pedal. I'll grab the stable handles, and then I'm going to go ahead and step up, bringing my surgical side onto the machine. Now, what's nice about the elliptical, better than the bike, is obviously I'm on my feet. I'm standing, I'm weight bearing. This is more functional because the goal is return to walking, and nothing is going to replace being on your feet. The bike is great for range of motion. The bike is great to unload the joint. But at the end of the day, we need to get back to walking. The other thing that I like so much about the elliptical, just like the bike, is I could start with gentle rocking just to warm it up. Remember, this is my surgical leg. I'm barely putting any pressure through that surgical leg, and I'm allowing it to just start rocking back and forth. When I feel ready, I can go ahead and start with a full revolution. And typically in my clinic, what I do is I explain to my clients, even if you feel like you can do more, I want to do 10 revolutions and then stop. And sometimes I even start with 1 revolution. I might say, get the pedal to go all the way around and stop. This way you have control over the machine. What's important to understand different between the elliptical and a treadmill is that the elliptical is powered by you. A treadmill will go with you or without you. There's certain inherent dangers in a treadmill. Now, I have a treadmill video. I'm not against treadmills, but if I was going to pick my preferred piece of equipment, it would be an elliptical over a treadmill. Other benefits to the elliptical: my feet never break contact with the pedals. So what that means is that there's a decrease in the impact forces my ankle, my knee, my hip, and my low back have to absorb. There's a vertical component on all treadmills. So this will inherently help build strength more than a treadmill would. And what I like most is because the pedals are connected, you're forced to take a symmetrical stride length, meaning the distance between the back foot and the front foot is the same distance with every step. Whereas when you first finished surgery, you were using your walker, maybe you progressed to a cane, we all tend to take a short step on one side and a longer step on the other. This allows the body, the brain, the nervous system to get comfortable taking symmetrical strides, which is ultimately what we want to get back to. We want to walk as normally as possible upon recovery. So guys, if you're looking at different devices, if you're thinking about maybe buying something for home, or when you get back to the gym, what kind of stuff you can do, the elliptical is an amazing option for you. The treadmill is great, the stat bike is great, the recumbent bike is great. There is no such thing as a bad device. There just may be a device you're not ready for. Now, talking about being ready, let's talk about getting off the elliptical. Again, if this is my surgical knee, what I'll do is I'll allow my non-surgical knee to go down. I'll take my surgical foot off first, and then I'll bring my non-surgical foot off second. Guys, if you have questions, if you want me to review any other pieces of equipment or continue to produce this content for you, I would really appreciate if you click that subscribe button. The more subscribers we get here, the greater our reach and the more content I can continue to produce. In the meantime, I hope you're staying safe. I hope you're doing amazing. And if you have questions specific to your condition, just post them in the comments below this video so I can produce new videos just for you. Guys, I'll catch you on the next one. Thanks for watching.